The following segment is being sponsored by El Paso Health.
Hi, today we have a very special guest. Her name is Carla Alvarado, and she's a child and adolescent psychiatrist. How are you doing, Dr. Alvarado?
I'm good, thank you. Thank you for having me.
No, thank you for being here today. Today we're going to be talking about anxiety. Could you please give us the definition for anxiety, doctor?
Okay, well, anxiety is a normal physiologic process that we all go through when we anticipate threat.
Okay.
And so it is also normal in different developmental stages of the child. So you have normal separation anxiety in an 8-month-old baby. When a stranger comes and takes the baby away from mom, the baby's gonna cry, and that's normal. And then you also see that anxiety in toddlers. So toddlers also can be afraid to wander too far away from mom, and that can also be normal. We also see normal anxiety when they're entering school, preschool years.
Okay.
And then we see it in every transitional stage. So when they go from elementary to middle school, and then from middle school to high school, and that's normal anxiety that we might have.
Okay. That's normal, and we don't have to worry about that.
We do not
type.
have to worry. When we start to worry is when that anxiety persists and it lasts for approximately 6 months, is what the DSM-5 tells us to look out for. But when it starts affecting our life, so when we're talking about children, it starts affecting their social life, it starts affecting their school, and it starts affecting them physically with appetite, with sleep,
Okay.
and producing physiological symptoms.
And that's what we hear as parents. Let's say they're going to go to school, and we hear this very often when our child is telling us, I don't want to go to school. I have a stomach ache. I have a headache. I don't want to. Is this part of anxiety, doctor?
Yes, definitely it can be. Those are some of the red flags actually that we need to look out for. If the child is frequently avoiding going to school, if the child is getting frequent headaches, if the child is getting frequent stomach aches, if the child is asking to go to the restroom a lot, that's also a symptom of anxiety. If the child is asking to visit the school nurse a lot. All of those are signs that maybe something is going on with my child, maybe my child is suffering from anxiety.
What happens if I think that, okay, anxiety is going to go away by itself. It's just a stage he's going through. Is that something that most parents do, doctor? Can you please educate us a little bit more as parents? When should I take my child to the doctor?
That's a very good question. So I think, I mentioned the red flags, and when those red flags start persisting for too long and they start affecting the social life, so the child no longer wants to go to birthday parties, the child no longer wants to participate in family events, is isolating to their room, the child is losing appetite, the child is not sleeping good. I think those are all important things to look out for, because if we do not treat anxiety, then it can progress to symptoms that are a little bit worse, like panic attacks. It can progress to like tic disorders, it can progress to OCD, it can progress to trichotillomania, where they start pulling their hair, they start pulling their eyelashes, or they start pulling their eyebrows. And then it could also lead to depression, because a lot of the kids that suffer from anxiety, they also have low self-esteem issues. And that's something that we also need to look at, that we don't want them to dip into the depression and have those negative thoughts.
Yes, yes, I understand. Doctor, so if we don't treat the anxiety, more than likely other things are going to come out, right?
Yes, they can. Yeah, right now in the pandemic, I am seeing those things that I'm mentioning, the trichotillomania, the pulling of the hair, the pulling of the eyebrows, the eyelashes, panic disorder, a lot of OCD, particularly because we're all afraid of germs. So a lot of washing of the hands, doing things repetitively, repetitive touching. I'm seeing quite a bit of that. But it is important to treat it on time, because it produces a lot of anxiety, a lot of stress for the child, a lot of anguish.
So what do I do once I see my child is having anxiety? Let's say once we're educating ourselves, so we see that my child does have a problem, he has anxiety. What do I do? Do I just take him to the pediatrician to begin treatment? Or what would you recommend? How do we begin treatment for anxiety?
I think the first thing is it's definitely the pediatrician, because we have to identify it. Validating the kid's emotions and recognizing and understanding, not dismissing it, but understanding that my child is struggling. So definitely the first line is pediatrician. Pediatrician will guide us as to where to go next, whether that's counseling, school, or specialty like psychiatry or psychology. But the school can also help. There are programs like the 504s where they can accommodate and they can help these children that have anxiety, whether it's allowing them to go get a drink of water if they see that the child is becoming very anxious, or giving them extra time on tests, or letting them turn in assignments at a little bit later time because they have so much anxiety and they were unable to focus. So all of those things, in addition to counseling, exercise, good diet, all of that is going to help with the anxiety.
This is very similar to the children who have ADHD, doctor. These accommodations that you were just mentioning right now. I guess a lot of children we were talking that have been diagnosed with ADHD, some of them had anxiety first.
Yes, and sometimes ADHD and anxiety are very comorbid, so they sometimes happen together. But it's also good to be able to differentiate between the two, because it's happened quite a bit of times when I get children that come to me with anxiety and are first started on a stimulant, because that anxiety produced problems with concentrations, problems with focus. Somebody gave them a stimulant, and then that produced panic attacks. Because we have to remember that first line for ADHD is stimulants. Unfortunately, if you have a child that's already anxious and you give them a stimulant, you're going to increase their sympathetic and cause more palpitations, more anxiety, and probably panic attacks. So it's good to first identify why is this child not concentrating? Is the child not concentrating because they're depressed, they're anxious, or because they have a concentration problem like ADHD?
Okay, this is very important. Doctor, when do I know, or I know once I take him to the doctor, I'll know if my child needs medication or not. But a lot of parents are very scared to give their children medication. Why is this, doctor?
So I've heard quite a bit of ideas that parents have brought to my attention. Some parents believe that we're going to zombie them out. And I think in psychiatry, we do have medications that can be rather sedating, and I think that's where that comment comes from. Not the typical antidepressants that we use to treat depression or anxiety. The other myth that we get is that they're going to be addicted to the medication. Yes. Again, that's false. Antidepressants are not addicting, and they are easily tapered down with the help of a professional. And the other problem that parents have is, will my child be on medication for the rest of their life? And that's something that I can say, no, that is not our goal. That is not the goal of pediatricians and not the goal of psychiatrists, I think. We want the child to do well and to get into therapy and to get into sport and to do school accommodation. So eventually we can taper down the medication.
Okay, and that's why it's very important for all of us to have a plan, right?
Yes, so it's going to be a collaborative approach. It's not just going to be medication. It's going to be the combination of support from family, combination of meditation or some religion or whatever it is that the family believe in. It's also going to be the combination of exercise, and I can't stress that enough.
Okay.
Combination of medication, and then the accommodations in school. Okay. Because the school support from the teachers, from the counselors, from the therapists in school, that's going to play a big role.
Awesome, doctor. And that's why it's very important for us as parents to really pay attention to our children's behaviors and go to the doctor. When you have a concern like this, seek for a professional help. And this is why we are trying to educate parents as much as we can about our children's problems. This is a problem that can affect the whole family. So as a family, we all want to get along. We all want to have a good relationship. And if we help our children out, it's gonna happen. So is there anything else that you would like to add?
I did want to make one last comment. I spoke about transitions, that children that are anxious struggle with transitions, and this whole pandemic was a transition.
Yes.
So we had to transition from face to face
yes.
to virtual to back to face to
Yes.
face, and then there's that unknown, like, is this virus going to come back? And so that produces a lot of anxiety in the children. But what I am getting a lot of is parents asking for like homebound, or parents asking for their kids to stay home. And I understand as a parent myself, a lot of the times we want to protect our children.
Yes.
But particularly for anxiety, we need to be cautious of that, of keeping them at home for too long. It is very important that they slowly reintegrate back into the school. That's going to help with the anxiety. They need to socialize with their peers,
Okay.
and they need to slowly go back into the school, because keeping them at home will feed into that anxiety, and it will actually make the anxiety worse. Because what ends up happening is we're feeding that thought that home is safe and the world is a scary
Oh,
place.
I see.
So I'm only safe at home and I cannot leave my home.
Oh.
And we're reinforcing that idea, which is what we don't want to do. So little
course
by
not.
little, I would encourage parents to reintegrate back into school.
Okay, awesome. Yeah, that's a very good point. And I guess that it's very hard for us as parents. We also get anxiety sending our kids back to school, and this whole pandemic, has been very hard on our families. We are very scared. The children are scared. If we as parents act like we're scared, of course, we are their example. So
Yes, yes. So with
What would you
anxiety,
recommend?
it's genetic, but it could also be learned behavior, right? So if our parents are anxious, we learn how to be anxious too.
so please give us a few tips as parents. What can we do to calm ourselves down, Doctor?
Yes, yes. So I did mention about the exercise part. I can't stress that enough, because there was a trend in weight gain, we were very sedentary during this entire pandemic. Sports were taken away. And besides exercise, sports also serves the purpose of socializing, and they removed that, right?
Yes.
During this pandemic, we had to isolate. And so I think that for parents and for kids, socializing however way we can is important.
Okay.
And exercising however way we can is important. I can't stress those two enough.
Okay. Well, thank you, Doctor. Thank you for being with us today, and we hope to see you very soon.
Thank you. Thank you for having me.